Hi everyone at the HA convention. Thank you for watching the video of poster F4.2. My name is Annie Hong from the Pharmacy Department of the Duchess of Kent Children's Hospital at Sandy Bay. And today I'm going to share with you about our experience at the Pharmacist Counseling Clinic for the same day admission of joint surgery patients. So without further ado, let's go into a bit more detail. The pharmacist team at DK have piloted a same-day admission counseling clinic, which runs parallel with the anesthetist outpatient sessions since the 24th of July 2020. How does it work? Patients who are eligible for same-day surgical joint procedure are being selected to attend pre-admission clinic for the anesthetist's final assessment and consent. After that, they will be seen by the outpatient nurse for further explanation on what they will expect on the day of admission. And lastly, they will come to see us. And let me walk you through the methodology. On each Monday, we receive a list of patients who are going to attend to the pre-admission clinic on Friday. And then on Tuesday onwards, based on the list, the pharmacist review each patient record through the CMS system. So the data we collected include demographic details, allergy profile, regular medications, and recent blood works. Then we make notes on medication of concern, as well as if there's any deranged levels, such as INR, renal function test, or liver function test. And then on Thursday, which is the day before the actual clinic, pharmacists will contact patient over the phone and ask them to bring in their medications, including supplements for reconciliation. And so we have arrived Friday. And as I have mentioned to you before, this is the usual procedure the patient will go through. And at our clinic, pharmacists review each regular medication that patient is taking. We often ask open questions and let them tell us what and how they have been managing their medications. In this way, we are able to assess their understanding and compliance. And if appropriate, we enhance the importance of home monitoring of blood pressure, blood glucose for their condition. We'll suggest patients to record the readings on a table and bring it to each doctor's visit. And it is also the anesthetist's requirement for patients to have at least 2 weeks of records with well-controlled blood pressure before they are being fully admitted. And lastly, we document all patients' self-purchased medications, supplements, and traditional Chinese medicines in notes. These may include calcium, vitamin, minerals. Sometimes we're being told that they're also on Chinese medicine, which contains ginseng, dongguai, which we like to avoid for the purpose of future operations. And then we lay our focus on the management of medications in regarding to the operation. As a general rule of thumb, self-purchased supplements, Chinese medicine, herbal soups, are suggested to stop at least 1 week before the surgery. The reason being that we want to minimize the risk to the operation being affected by any external source of supplement to the minimal. Antihypertensive are to be continued in the morning of surgery. That's to prevent rebound hypertensive crisis. Diuretic may occasionally be omitted to avoid dehydration, but then the decision is based on the patient's clinical status and the combination of medication that the patient is actually taking. Anti-diabetic agent should be omitted once fasting has commenced the night before surgery was scheduled. And with antiplatelet and anticoagulant, aspirin, it can be continued due to its short half-life. But then, of course, it is once again depends on the patient's condition. And recently, I have a gentleman who is required to stop aspirin 10 days before admission due to his high risk of bleeding. So it is patient-specific. And clopidogrel, it is normally discontinued 5 days before the surgery. Then warfarin, normally it will be discontinued 3 to 5 days before the surgery. And then INRs are to be closely monitored and physician to determine if bridging low molecular weight heparin is required. With DOACs, due to their relatively short half-lives and better safety profile, that makes them easier to discontinue or resume rapidly. And it is usually around the duration of 48 hours before surgery. So specific arrangement to DOAC will be discussed with the anesthetist before we call in the patient for counseling. And when we have a decision, we pharmacists would reinforce that information with the patient. Pharmacists then document all discussion and findings in the CMS system. From the 24th of July 2020 to 19th of March this year, a total of 167 patients have attended the pharmacist clinic for same-day admission joint surgery. The clinic has provided a platform for patient-pharmacist interaction, enhance patients' compliance and understanding to the medication that they're taking. It once again serves as a platform for patients and their carers to clarify misunderstanding and concern. And most importantly, the pharmacist-led clinic has further promoted patient safety while undergoing surgery. And may I take this opportunity to say thank you to Dr. Chen Heng Chun, Dr. Chen Pei Yan, our pharmacy manager, Ms. Lily Chu, for their continuous advice and support. And of course, our team of clinical pharmacists, the nursing staff and medical record staff at the outpatient, the last but not the least, dispenser and supporting staff of the pharmacy department. And I would like to conclude my presentation here. I hope you enjoyed the rest of the conference. Thank you very much. Bye-bye.